So in case study number 1, we have Tracy. Tracy is a 25-year-old grad student, and she's coming into your clinic complaining of a mild sore throat, a mild fever. She's also complaining of nasal congestion. Now, she says that all of this started 2 days ago, and she's been feeling a little bit achy, and she's been feeling tired since then. Now, she mentions to you that she's been studying a lot late into the night for her midterms, and now her symptoms are getting worse. Now, when you examine her, you notice that her tongue is actually slightly red on the tip and that there's a thin yellow coating there. You notice that her pulse is actually floating and slightly rapid. You also notice that she has some sweat on her forehead, and she says that she sweats spontaneously. She also says that her throat feels scratchy and it feels irritated. Alright, so now let's pause. Now think about it. What is your diagnosis here? And I'll give you 4 multiple choice. So we have A, wind heat. We have B, damp heat. We have C, wind cold. Or we have D, heart heat. All right, so now the answer to this one is actually A, wind heat. So now let's break down the symptoms and you'll see why it's classic wind heat. So one of the first things that should pop out to you when you're reviewing the question is the sore throat, also the mild fever, and the yellow coating on the tongue. Now, these are key giveaways that there's both wind and heat present in this patient. With this case, there's also sweating there. And that's because the wind heat can actually slightly open up the pores. With this case, there's also a fever. This fever, though, is mild. And that's how you know it's not a full-blown heat or a full-blown fire pattern. But you see exterior manifestations like the fever, the slight sweating, and the sore throat. And with the pulse, you see a floating rapid pulse. Now, a floating pulse, that's indicative of an exterior condition. And the rapid pulse, that's how you know that there's heat involved as well.